Right, Dr. Vishakha Shivdasani, physician practicing longevity and disease reversal, is now joining us. I want to begin by asking you, explain to us what exactly are hormones, and we of course are talking in the context of weight loss, working out, eating right, but are hormones at the end of the day controlling at the end of the day how much we weigh and controlling our weight in a big way, isn't it, Dr. Vishakha?
Hormones are chemical messengers. What they do is they help us control various functions in the body by passing messages through the bloodstream to various organs of the body, be it skin, muscle, tissue, etc. And by then telling that part of the body what to do and when to do it. As far as weight is concerned, hormones help us in a multitude of ways. They signal the brain and tell us when to eat, how much to eat, when to stop eating, how much muscle to build, where to store fat. That's all governed by hormones. So, I very often tell my patients, Neha, instead of focusing only on calorie in versus calories out, which is what the whole world seems to focus on, make that shift into focusing on how to balance your hormones. Because if you do that, I can tell you that weight loss will almost always happen seamlessly.
All right, hormones for all of it. When we are putting out those graphics that talk about how different kinds of hormones regulate, our weight essentially. But tell us a little about the belly, the pot belly that most of us seem to be having here, including myself. I'm told it's a stress belly because I'm working out and I'm also eating right most times, But a stress belly, a cortisol belly is what is the most difficult thing to get rid of. What is it exactly, and how does we get fat around the belly if you're stressed? What's the science behind a cortisol belly?
So a cortisol belly is typically fat that is accumulated around the abdomen when you have elevated cortisol levels because of chronic stress, poor sleep, and can also sometimes be because of certain health or medical conditions. Now, evolutionary, a cortisol belly is actually a result of your body trying to protect you, thinking you're going to go through long periods of chronic stress, like say a famine or a drought. But in today's day and age, instead of protecting you, what this cortisol belly does is it predisposes you towards getting insulin resistance, type 2 diabetes, fatty liver, heart disease, and what have you. So it's switched gears in that sense. And a cortisol belly is deep. It's the visceral fat. It's not the subcutaneous fat. So, the fat that you can actually pinch around the belly, that is not really the dangerous fat. The dangerous fat is the one that you can't see. It's the one that's surrounding the organs, and that is what a cortisol belly does. So you need to make the correct lifestyle intervention to make sure you don't have this cortisol belly and you lose it, so that you don't get the medical conditions that go hand in glove with this belly.
All right. Okay, that's something that I didn't know about, but it's great that you point that out, So there's a difference between pot belly in general and, of course, visceral fat that you spoke about. But I want to know, how do I get to know if I've got some sort of a hormonal imbalance and how that is making me gain weight, that is the reason? Which are the tests to be done to find that out?
So actually, hormonal imbalance is pretty much a spot diagnosis. Very often with the symptoms and the way a patient looks, you can actually tell if they've got hormonal imbalance. For instance, if someone comes to you with insulin resistance, will typically have weight around the midriff that can be similar to a cortisol belly, but will also complain of, or if you look at the person, will have, darkish, thick skin on the nape of the neck or on the folds of the skin, on the armpits. This is called acanthosis nigricans, which is classic of insulin resistance. You can get xanthelasmas, which are fat deposits around the, just below the eyes. And that happens also in insulin resistance because of fat deposits. The patient will complain typically of feeling very hungry but craving more carbohydrate-rich foods. So that is insulin resistance. The same symptoms can be for PCOS, except for PCOS you can get irregular periods and hirsutism, which is extra body hair and acne. With cortisol belly, we've said you get a cortisol belly. The patient also gets difficulty to sleep at night and cravings not just for sugary food but also for salty foods. So that's a differentiating factor. Then of course you've got hypothyroid, which is slow thyroid, where you can get dry skin, you can feel intolerance to cold, you get constipated, and our patients will come and say, We just have to sniff food and we will put on the weight. That reflects slow metabolism and hypothyroid. Now, two very important hormones that are not spoken about are leptin and ghrelin. In today's day and age, we talk so much about GLP-1 analogs and Ozempic and Wegovy and Mounjaro and what have you. And there is a place for these. These are great drugs for people who've got diabetes and other comorbidities. But for someone who's using it just for weight loss, remember that these hormones that are secreted essentially in the gut play such a big role for satiety and for hunger. And it's the imbalance of these two that can cause your weight not to drop and actually to pile on. So if you use the correct lifestyle intervention, correct food, correct supplements, exercise, correct sleep habits, etc., you can actually balance these two hormones and can reset your metabolism such that you drop the weight easily.
Right. Let's tell you about the urine test to monitor hormone levels over time. It's helpful for evaluating sex hormone imbalances and adrenal function, addressing hormone metabolites, providing a broader picture of hormone activity, evaluating hormone fluctuations during the menstrual cycle. For example, measuring FSH in urine can be done to monitor menopause. What about the other tests that can be done? Imaging tests, ultrasounds to visualize the uterus, ovaries, testicles, thyroid gland or pituitary gland and identify any abnormalities like cysts or tumors. MRI is done to provide more detailed images of these organs and assess any underlying causes of hormone imbalances. X-ray is done to identify bone density changes that could be related to hormone imbalances such as osteoporosis. All right. I want to move on further and I want to ask you, should I be going, and anybody would be going for hormone tests, why should I go for these hormone tests? And when do I get really, an idea that, it's time now for myself, for me to get tested?
So, our symptoms, they only put us in the correct direction. We need to clinch the diagnosis with a blood test. And when you correct the hormonal imbalance, stubborn weight loss becomes so much easier. By the time you actually manifest things, sometimes it's too late. I always tell my patients, Neha, that tests don't guess because our body is very good at hiding disease. So a blood test, actually, the correct blood test, give you a 360-degree overview on your current metabolism, on your current hormonal status, and even whether you're chronically inflamed or not. So it's difficult to say what test everyone should run because it's bio-individual, and depending on your symptoms and your, then we would decide what parameters need to be checked. But predominantly, I would say that everyone needs to run at least an executive profile, which will cover your liver, lipid, kidney, your not just your hemoglobin, but also your iron profile, of course, your vitamin B12 and D3. Then, based on your specific symptoms and your age, we will decide what hormones you need, whether you need FSH, LH, prolactin, if you're looking at, say, PCOS, whether you need estrogen, progesterone done at a specific time of a month. That is very important if you're perimenopausal or menopausal. Of course, thyroid tests, while it's important to do your FT3, FT4, TSH. If you've got a family history and are putting on weight and very prominent symptoms, I would recommend also doing thyroid antibodies. So these are ballpark tests that we would run for our patients, but of course specifics are very important in medicine and can change based on your symptoms and the patient's symptoms.
All right. And Dr. Vishakha, I'm going to thank you for joining in, telling us about these tests that can be done, and also, of course, the fact that hormones play a very, very big role in controlling, how we look, of course, the kind of weight that we accumulate, the kind of fat that we accumulate around our stomach, and problems associated with hormonal imbalances. Thank you.